Hi everyone, I'm Heather Wen, a retired nurse practitioner and the founder and practitioner at Arizona Healing Alternatives. I'm passionate about you knowing what your options are, whether it's in Western medicine or alternative medicine. So stay tuned for this aha moment. For today's aha moment, I want to look at something called TBI, which is traumatic brain injury. It may or may not mean what you think it means, but if it does, let's explore it. Let's see what are the causes, what are the differences between mild, moderate, and severe, and what can you do about it so you can feel your very best. When I was going through nursing school a very, very long time ago, we talked about things and we didn't call it TBI or traumatic brain injury, but I'm kind of glad they've given it a name because back when I was studying, we were talking about concussions or contusions, and the definitions have changed a little bit. But what is it about? Well, concussion, let's go through any kind of trauma to the head at all or to the brain. When we look at the skull, we know that the skull is surrounded by and the brain is encased by this hard skeleton. So we naturally assume that when the brain that's inside of that is well protected, but not necessarily. So when anything hurts or damages or injures the head area, lots of things can happen. And so, what are the different things that can happen? Well, any kind of blunt trauma to the skull can cause a problem. It could be a fall, it could be an auto accident, it could be any number of things that, you fall off the ladders, something hits you in the head, whatever that is. It depends on whether it actually breaks the surface of the skin and the skull or whether the skull stays intact. So, what can happen is, and I remember when I was in school. When I was in school, we learned that there was the differences between a concussion and a contusion is what we called it. And they still call it that, but a concussion would be, we would think, okay, you have that protective skull, so why should the brain get hurt at all? Well, basically the skull, the brain is sitting in the skull, but there's some room in there and there needs to be. Because if there's too much, that puts too much pressure on the brain if there wasn't room for the brain to move around a little bit. So if something happens and there's some kind of head trauma, what can happen is, like I said, there'll be two kinds. There's either the kind where you just have the trauma on the head, but there's other times when you can have a trauma that ends up penetrating and actually into the brain tissue, which is not good. But a concussion looks like, and what I was always told when I was in school was a concussion is if something happens, and let's say I'm going to take the example of an auto accident. So if you were in an auto accident and all of a sudden your head got jostled around, there can be whiplash, which is the whip of the head going back and forth. But what can happen is the brain can move around in there. And they sometimes call it twisting, which it's just movement. Okay, so if the brain moves around in there, then you could lose consciousness. And they would say a concussion is if you are out or lose consciousness for under 5 minutes. And then if it's over 5 minutes, it's a contusion. And a contusion is like a brain bruise, for lack of a better term, which means some of the blood vessels can bleed a little bit and cause like a little bruising of the brain, and that would be over 5 minutes. But in the definitions now of traumatic brain injury, they look at loss of consciousness as to whether it's under 30 minutes or whether it's over 24 hours, because then we're talking about a coma or other things like that can happen. That can happen even when the brain, there isn't an injury to actually through the skull to the brain, just on the skull. And they differentiate it, and what I'm going to do is I'm going to put in the comment section, I'm going to put, not in the comment section, but in the narrative section of the video, a couple of really good articles on this and how they differentiate it. But they differentiate it into mild or moderate or severe. And when we're talking about severe, we're talking someone's in a coma. We're talking about severe when it comes down to having to have surgery to relieve the pressure, because if the brain swells too much, then you can actually get brain damage if there's too much pressure, and sometimes you have to open the skull to relieve the pressure. But when it comes down to it, even if you don't lose consciousness, if you have a concussion or the brain gets kind of moving around a bit for whatever reason, you can have lots of symptoms afterwards. So let's talk about those for a minute. What does that mean? Well, it could be very mild. In mild cases, it could just be, wow, I had a headache after that auto accident, or I had some, nausea, or I was feeling a little weird. But nausea, you have to be careful of, because what can happen is mild forms of this. The interesting thing to me, what can happen is you can actually have you don't have symptoms right away because you have a lot of adrenaline if you fall or if you're in a car accident. But basically, it can show up hours later, weeks later, months later. And whether it's mild or moderate or severe can depend on what symptoms you have. Some people, it's just headaches. Some people, it's just some pain. Some people, it can actually be visual changes. You can it's double vision, or it's strained. Sometimes all of a sudden it's with the light, that all of a sudden you can be very sensitive to light after something like this happens. And that can go into more of the physical symptoms. And another one of the symptoms can be overly tired or fatigued. Now, of course, if you've been in an accident, something like that, you could be, especially if they gave you hefty duty medications, you can feel tired and fatigued. And there's lots of other reasons for feeling tired and fatigued. But it's very important, especially if you've been in an auto accident or things like that, that if you're feeling more sleepy and just feel like you can't stay awake, it is very, very important to go get checked out. And the other important thing to remember is that in children, sometimes these symptoms can be a lot different. So let's say in an infant, because the infants, they have a different issue when it comes to their anatomy and their structure, and there's parts of the brain that still, if the skull hasn't completely formed and completely come in, there's suture lines that come together and make the bone more solid. So there's a little anterior and posterior fontanelle that are little open soft spots. Things can be different. So sometimes in infants or in children, it can be more of a fussiness and agitation, things like that. So it's very important to also get kids checked out if in fact they've been in an accident, they've had a fall, things like that as well, and start, maybe they're not feeding as well, or issues like that come up after something like that happens directly when there's been an injury to the head. But here's the interesting part. There can also be emotional symptoms. It can actually, depending on the type of injury to the brain, can actually change some different functions and some different biochemicals or chemicals in the brain that can lead to situations like anxiety, depression, things that we would never have associated or thought were associated with, blow to the head or a traumatic brain injury. Even if it's mild, you could see anxiety, you could see depression, you could see other things that can cause problems later on, even sometimes a long time afterward. Now, of course, if the injury is more severe, sometimes people are in the hospital in the intensive care unit. They sometimes are put into a medical coma so they can relieve the pressure in the brain and other things like that. If it's what's called an open, which we talked about, where it actually goes through the skull to the brain. There can be long-term implications, speech problems, all sorts of different things that can happen to a brain when it's been injured. And some of the other things that can be interesting about what you experience, some people actually experience changes in taste or smell. Some people actually experience they're confused, it's hard to concentrate, things like this that you wouldn't normally associate with this. So I think the really, really important thing to take home with this is, even if you just have a little mild bump on the head, you need to be watching for symptoms that might come up that you might not necessarily expect, because it's important to go in, get tested, and see. Sometimes they'll do CT scans, sometimes they'll do MRIs, they'll do other scans. The first and most important one is, especially if you've had a contusion and there's been a bruise to the brain, or you were unconscious at all. I don't care if it's, under 5 minutes, I don't care what amount of time. It's definitely important from a Western medicine standpoint to get checked out to make sure that there isn't a serious brain bleed. And a bruise is that. A bruise is when the brain, the little blood vessels, can bleed a little bit. And that's very, very important. That's very different from a stroke, different situations with that. But it's really, really important to get checked out. And once you do, if they say everything's fine and you can go home, is to watch for some of these symptoms even later on. So with some of these symptoms later on, like I said, it can be, even changes. What's fascinating is sometimes there can be changes in personality, and changes in personality such as not only depression and things like that, but sometimes for some people it's impulse control. It shows up in other different ways that you wouldn't have imagined, where all of a sudden this person is having difficulty with, almost obsessive compulsive thoughts, or almost um, difficulty where, oh my gosh, if they don't have, let's say it's ice cream or something, they have to have it right now, and they get really irritated if they don't. So there can be agitation and other things emotionally that take place with this. So what can you do about it? Well, the first and foremost is getting things checked out. Obviously, if things come up later on, to get it checked out. But there's lots of different Western medicine and alternative things that you can do. Some of it ends up being physical therapy, speech therapy, occupational therapy. There can be other neurological things. Sometimes you may need to see a neurologist and see. Sometimes there's medications. Obviously, if it's a mild form, most of the time they're going to say, go home and take some kind of pain relievers, some mild pain relievers, from Tylenol to NSAIDs, or the ibuprofen or things like that, if you can take it for discomfort. But if in the long run, there are things to look at if you need some extra help with that. Now, when it comes to the emotions, sometimes it can be counseling, Western medicine counseling. The neat part about, and even acupuncture or other things like that may help, and I would also follow up with naturopaths to see if they have supplements that can help with this. In what I do in Total Body Modification, or TBM, we do have actual corrections for traumatic brain injuries, and I've seen it do some pretty amazing things for people to help clear up some of these symptoms for them. So whatever it is you try, the take home is, even if you just get, a tiny bump, or something's happened, is to always watch for any signs and symptoms of any issues that may come up, and watch it for a while, and even, and not just assume, oh, the reason why I'm feeling anxious is for another reason, that it may actually relate back to an injury that you've had. Thank you so much for listening. I hope this has been helpful. Please, you can leave comments in the comments section and let me know if you have any further questions about this.